Module 2 Histopathology. 1. Introduction to histopathology. Histopathology is the study of changes in tissues caused by disease. It focuses on examining cells and tissues under the microscope to understand the cause, mechanism, and effect of disease processes. It is a vital bridge between laboratory science and clinical medicine because it provides definitive diagnosis for many conditions. It helps determine treatment choices and prognosis. It contributes to medical research and understanding of disease patterns. In practical terms, histopathology involves proper collection of specimens, correct preservation to prevent decay, careful processing into thin slices suitable for microscopic study, detailed interpretation by trained pathologists. 2. Fixation in histopathology. Fixation is the first and one of the most critical steps in tissue processing. It preserves tissue from autolysis, self-digestion, and putrefaction, bacterial decomposition, and maintains the structure as close as possible to the living state. Why fixation matters? Prevents breakdown of cell structures. Maintains chemical composition of tissues. Prepares specimens for staining by stabilizing proteins and other cell components. Common fixatives. Formalin, 10% neutral buffered formalin, the most widely used fixative. Alcohols, ethanol, methanol, good for cytology specimens. Boron solution, excellent for preserving soft and delicate tissues. Glutaraldehyde, used for electron microscopy. 3. Effect of fixation. Fixatives act by cross-linking proteins, making them insoluble and resistant to enzymatic breakdown. Stabilizing cell membranes and organelles. Sometimes altering the staining characteristics of tissues. An inadequately fixed specimen may shrink, harden unevenly, lose morphology, or develop artifacts that mislead diagnosis. 4. Common fixing agents and their uses. Formalin, routine histology. Glutaraldehyde, fine structural preservation for electron microscopy. Ethanol/methanol, cytological smears and rapid fixation. Osmium tetroxide, preserves lipids, also for electron microscopy. 5. Secondary fixation, post-fixation, and modernising. Secondary fixation, a second fixation step, often using a different chemical to enhance preservation or staining. Post-fixation, applied after initial fixation, commonly in electron microscopy to stabilize structures further. Modernising, using chemicals, mordants, that bind to tissue components and dyes, improving staining intensity and stability. 6. Fixation pigments. Some fixatives leave behind pigments that can interfere with diagnosis. Formalin pigment, lacet formaldehyde hematone, dark brown, prevented by using neutral buffered formalin. Mercury pigment, from mercury chloride fixatives, removed with iodine and sodium thiosulfate. 7. Decalcification. Decalcification is necessary when preparing hard tissues, bone, calcified cartilage, teeth, for sectioning. Agents, strong acids, nitric, hydrochloric, for speed, weaker acids, formic acid, for better morphology, chelating agents, EDTA, for gentle decalcification. Over-decalcification damages cellular details and should be avoided by careful monitoring. 8. Dehydration, clearing, and infiltration/embedding. Dehydration removes water from tissues, usually using graded alcohol concentrations. Clearing replaces the alcohol with a solvent, e.g., xylene, that is miscible with embedding media. Infiltration/embedding saturates tissues with a supporting medium, e.g., paraffin wax, and solidifies it for section cutting. 9. Frozen and celloidal sections. Frozen sections, quick preparation of tissue by rapid freezing and cutting on a cryostat, used for intraoperative diagnosis. Celloidal sections, embedding in celloidin, a cellulose nitrate, for hard or delicate specimens, rarely used today but excellent for avoiding shrinkage artifacts. 10. Embedding media. Paraffin wax, most common, allows easy sectioning and storage. Resins, used for high-resolution microscopy. Gelatin, for specialized applications like hole mount specimens. 11. Basic histology of organs. Every organ has characteristic microscopic features. For example, liver, lobular architecture with hepatocytes and central veins. Kidney, glomeruli and tubules arranged in cortex and medulla. Lung, alveoli and bronchioles. Understanding normal histology is essential before identifying pathological changes. 12. Exfoliative cytology. Cytology involves examining individual cells rather than whole tissues. Exfoliative cytology, cells shed naturally or scraped/brushed from body surfaces, e.g., pap smear for cervical screening. Requires correct collection, fixation, often with alcohol-based fixatives, and staining. 13. Collection and fixation of cytological specimens. Fluids, urine, pleural fluid, collected in sterile containers, processed quickly. Scraping/smears, fixed immediately to prevent air-drying artifacts. Brushings, useful for respiratory or gastrointestinal tract samples. 14. Museum technique and color restoration. Pathology museums preserve specimens for teaching and research. Mounting in jars, specimens fixed, stored in preservative solutions, and sealed. Color restoration, special techniques to enhance or retain natural colors for educational value. 15. Mounting in museum jars. Specimens are suspended in glass jars containing preservative, e.g., formalin, Kaiserlin's fluid. Jars are sealed to prevent evaporation and contamination. 16. Tissues and cellular injury. Tissue injury occurs when cells experience stress beyond their adaptive capacity. Reversible injury, swelling, fatty change. Irreversible injury, necrosis, apoptosis. 17. Inflammation. Inflammation is the body's protective response to injury. Acute inflammation, rapid onset, mainly neutrophils, resolves quickly. Chronic inflammation, long-lasting, involves lymphocytes and macrophages, often causes tissue destruction. 18. Healing and repair. Healing occurs by regeneration, replacement with the same type of cells. Fibrosis, replacement with scar tissue. Factors affecting healing include blood supply, nutrition, infection, and age. 19. Gross postmortem slide examination. Pathologists examine organs removed during autopsy both grossly and microscopically. Normal features, expected size, shape, color, consistency. Abnormal features, tumors, infarcts, fibrosis, inflammation, hemorrhage. 20. Tumors and histological appearance. Tumors may be benign, well-differentiated, slow-growing, localized. Malignant, poorly differentiated, fast-growing, invasive, and capable of metastasis. Common tumors seen in routine histopathology include carcinoma, sarcoma, lymphoma, and melanoma.